Good day, everyone. My name is Julie McKinney, and I am a nurse practitioner student at Southern Adventist University. And today we're going to be talking about traveling without malaria. So first of all, let's start out. What is malaria? Well, according to World Health Organization, malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of an infected female Anopheles mosquito. It is preventable and it is curable. So some brief facts about malaria. In 2017, 219 million reported cases of malaria occurred worldwide, and 10,000 travelers from non-malaria regions fell ill after traveling to malaria endemic regions. So it's because of those 10,000 travelers that occur approximately each year that we really want to make sure that you, as a traveler, if you happen to go to a malaria region, don't fall ill. 87 countries in the world have reported malaria. Does not mean every area of every aspect of every country has it. However, while you're at that country, it is wise to be at risk, to know that you are at risk and to be aware so that potentially if you either have the disease, you can know when to get treatment or even to prevent it and take the proper medications. 3.2 billion people worldwide are at risk. And in 2018, there were 228 million malaria cases, 405,000 worldwide deaths, and 2.7 billion US dollars were spent on malaria. So how is malaria transmitted? Malaria is transmitted through the bite of the female Anopheles mosquito. Who is most at risk? Pregnant women, young children, and travelers. When are you most at risk? Dawn and dusk. This is when mosquitoes are the most active and you're most likely to become bitten. So this is when you have to be the most careful. So how can I prevent malaria? Because it is completely preventable. Sleeping under an insecticide-treated bed net. Those that live in targeted areas, they should have the inside of their home be sprayed with insecticides. So that's just something to be aware of. And then preventative medications for travelers. Also wearing protective clothing and using proper insect repellents. So what sort of symptoms should I be looking for? If you did get malaria, what are you going to look for? Headache, nausea and vomiting, fever and chills, and diarrhea. Fever is one of the top things that is noted in malaria. And if you think you've become infected, how soon should you get tested? Right away, as soon as possible, within 24 hours if possible. Why? Because malaria can be life-threatening and treatment is necessary for the restoration of health. If you see that in that photo right there, there's a lady holding a test strip. Often in places where there's malaria, there will be workers that can test you quickly so they can get you the proper medications. They'll do a little prick in your finger, put a drop of blood into that test strip, they'll put some solution in, and within a couple minutes, you will know whether or not you test positive for malaria, and then you can get the proper treatment. So, what do you do about this? Know before you go. If you're already overseas, that is okay. You can go on the CDC website and look up, what things you should be looking for and if malaria is in the area that you live in. Or if you're about to go and do some student mission work or travel, go to a local travel clinic and receive information about medications and vaccines. They can prescribe you the medications to properly take while you are overseas, and that way you are prepared for travel. And these medications, they're very helpful because it suppresses the proper chemoprophylaxis, which is the technical term. It suppresses the blood stage of the malaria infections and therefore prevents the disease. So even if you're bitten by a malaria-carrying Anopheles mosquito, you can take this medication and it will help prevent that. So something to be aware of, due to the misuse of malaria medication, there are approximately 60 countries where malaria is resistant to medications. So if and when you do have malaria medication, make sure you're taking it properly. And we really don't want this to get out of control because it's really important. Obviously, you can see the spread. There's 87 different countries in the world that are affected by malaria. And we really want to make sure that medication is being taken appropriately because resistance can start happening, and that's bad news. So let's do a quick acronym for malaria protection. This was created by the World Health Organization. First of all, A, be aware of the risk, incubation period, possibility of delayed onset, and main symptoms. So let's talk about this. What is your risk? Well, we talked about it, 87 different countries. Incubation period. So you can get malaria 7 days after you are bitten or up to 3 months after you're bitten. So it's really important if you have symptoms that we talked about before, the headache, the nausea, the vomiting, the fever, the diarrhea, you could be exhibiting symptoms 3 months after you've come back from that malaria place. And so you want to make sure you're getting appropriately tested. If you do get ill like that, make sure you get checked out and make sure that it's not malaria. So that's talking about the delayed onset. B, avoid being bitten by mosquitoes, especially at dawn and dusk. C, take anti-malarial drugs, chemoprophylaxis, when appropriate, at regular intervals to prevent acute malaria attacks. D, immediately seek diagnosis and treatment if fever develops 1 week or more after entering an area where there is malaria risk, and as we talked about earlier, up to 3 months after departure from that risk area. And E, avoid outdoor activities in environments where mosquitoes are breeding. So swamps, marshy areas, especially late evenings and at night. Like we talked about, that's when the malaria mosquitoes are most active. You may also want to be aware of, are you breeding malaria mosquitoes where you are? Mosquitoes love calm, standing water. So if you have a lot of that, either cover it so the mosquitoes can't get into it, or, don't have buckets with water that doesn't, you just want to make sure that you're not at risk. So here are some resources on places that you can go online on the World Health Organization and the Centers for Disease Control and Prevention. If you go on Center for Disease Control and Prevention, you can go to destinations for travelers. You can choose what country you're going to, and it will tell you all the different risks of all the various different diseases that you could get while you're there. And then the World Malaria Report actually has an app, so you can find out more information about malaria, about policies, financing, interventions, and that sort of thing. It lets you know what is going on in the world with malaria. And these are my references. Thank you so much for your time, and best of luck and wishes as you carry on in your travels.